St. Mary's Rehab Unit is one of about a dozen facilities that has an over-the-ground dynamic weight-bearing system, the ZeroG. We've had it for about 9 months, and we've seen excellent results with our patients. Sometimes it's just a matter of the patient needing a little bit of confidence to know that they can get up and mobilize and that they aren't going to fall or they're not going to be a burden to another person. And there are times where we've actually seen patients who were unable to walk who can then start to stand and in a few days are actually able to take some steps. Whereas if we would have had 2 or 3 people trying to support them and help facilitate that gait, it would have been much more challenging for the therapist and also for the patients. I'm Julia Boysen. I'm the therapy manager for the Inpatient Rehab Unit at St. Mary's Hospital, which is part of Mayo Clinic in Rochester, Minnesota. The main thing with the ZeroG is because it's a dynamic support system and the way it facilitates across the trunk, it allows people their normal balance responses. So they can shift their shoulders, they can shift their hips, they can move their feet. The ZeroG, there's nothing that's moving the limbs for the patient. The patient still has to be able to move their limbs, or they need the therapist to facilitate that movement. So the different diagnoses we can use is any neurological diagnosis, as well as a peripheral neuropathy or a steroid myopathy type of a patient, or even a critical illness myopathy. So anybody who has been bedridden for a long period of time, who has decreased strength, either from a musculoskeletal standpoint or from a neurological standpoint, would benefit from this device.